The ablation procedure is really basically pretty straightforward. A patient comes into the hospital, receives an IV, and then gets a light anesthetic so that they're asleep, basically not aware of what's going on. And then we access the femoral vein in the groin region, much like a conventional heart catheterization procedure. It's a small puncture hole, doesn't involve any stitches. And through that we thread a series of plastic tubes from the groin up into the heart and access the area where most of the atrial fibrillation comes from. And that's the junction where the blood vessels which return blood from the lungs to the heart connect to the heart, something called the pulmonary veins. There are typically 4 of them, and they live on the back side of the left upper part of the heart.
Once we have catheters in the left atrium, we can then measure electrical signals coming from all the pulmonary veins, which are our targets, and then we bring the cryo balloon catheter up into the left atrium in a deflated state. We will then position it near the pulmonary vein we're targeting, and then inflate the balloon and gently apply pressure against the balloon at the opening of the pulmonary vein. This occludes blood flow temporarily and allows us to deliver the cryo energy to create pulmonary vein isolation. After about a 4-minute energy application, the balloon is then deflated and removed away from the pulmonary vein opening, and we can then go back and measure with our electrical catheters whether we've achieved the isolation we want or whether we need to go and do additional energy applications.
The fundamental difference between conventional radiofrequency ablation, which is the technique that we've been doing for essentially the past 10 years for atrial fibrillation, and cryoballoon is very easy to understand. In the radiofrequency approach, we do a point-by-point ablation. So if the goal is to isolate one of these pulmonary veins, we have to take a catheter and move it, and at each individual dot destroy a particular area of tissue, and do that in a what's called circumferential manner around the mouth of the vein. That requires a greater degree of skill and time and patience in terms of moving the catheter, because remember, the heart's beating and moving the whole time that you're doing that, and you're trying to synchronize the zaps so that you get exactly the right area. The beauty to the balloon is that we're taking it and sealing that whole area, and with one application we're creating a nice circumferential lesion, which is a destruction of tissue by the freezing approach, all the way around where that balloon comes in contact. Not all of the blood vessels are perfectly round, and it does require some unique skill in terms of manipulating and recognizing the way the balloon fits into that location.